We all want what's best for our children. We want them to thrive. But sometimes, kids struggle with their emotions and behavior. That's where the community behavioral health system steps in. It's a safety net, providing essential support for children and families facing mental health challenges. This system is complex. It involves many different parts working together. Understanding this system is crucial. It helps us ensure that children get the right help at the right time. This system doesn't operate in a vacuum. It's connected to other important systems. We're talking about social services, the justice system, and healthcare. All of these play a role in a child's well-being. Think of the community behavioral health system as a team effort. Each player has a vital role. Imagine the community behavioral health system like a house. It needs strong pillars to stand tall. Let's look at some of these essential components. First, we have community mental health centers. These centers are hubs of activity. They offer a wide range of services, from therapy and medication management to crisis intervention. Then there are residential treatment facilities. These provide a structured living environment for children and adolescents with more intensive needs. They offer therapy, education, and life skills training. Outpatient clinics offer another level of care. They provide individual and group therapy, medication management, and other services on a less intensive basis. Finally, we have mobile crisis teams. These teams are first responders for mental health crises. They provide on-site assessments, de-escalation, and connections to necessary services. These components work together, ensuring that children can access the level of care they need when they need it. Within this system, many dedicated professionals work tirelessly to support children's mental health. Think of them as the team working inside the house. Child psychiatrists and psychologists play a critical role in diagnosing and treating mental health disorders. They provide therapy, medication management, and work closely with families. Social workers are also vital members of the team. They connect families with resources, advocate for their needs, and provide counseling and support. Counselors and therapists offer individual and group therapy. They help children develop coping skills, process their emotions, and navigate challenging situations. Case managers are like navigators. They help families access services, coordinate care, and ensure that children are receiving appropriate support. Collaboration is key. These professionals work together, sharing their expertise to create the best possible outcomes for children. The community behavioral health system doesn't exist in isolation. It reaches out and connects with other essential systems like social services. Child protective services often work hand in hand with behavioral health providers. They share information, coordinate services, and ensure the safety and well-being of children who have experienced abuse or neglect. Educational services are another critical partner. Schools often have counselors and social workers who can identify children struggling with mental health issues. They can connect families with community resources and provide support within the school setting. Housing support is also important. Stable housing is essential for mental health. Behavioral health providers can connect families facing housing instability with resources and advocacy. Case managers often act as liaisons, ensuring that families navigate these systems smoothly and receive the support they need. Section 5. Breaking the cycle. Behavioral health and the criminal justice system. The intersection of behavioral health and the criminal justice system is complex, but crucial to address. Many youth in the justice system have underlying mental health needs. Juvenile justice programs are increasingly incorporating mental health services. This includes screening, assessment, and treatment for mental health and substance use disorders. Mental health services are also essential within detention centers. Youth in these facilities often have complex needs that require specialized care and support. Re-entry programs are vital for youth transitioning back into the community after involvement in the justice system. These programs should include mental health support, substance use treatment, and connections to community resources. Special highlight. Diversion programs are key. They aim to keep youth with mental health needs out of the justice system by providing alternative support and interventions. Section 6. A holistic approach. Integrating behavioral health and healthcare. Integrating behavioral health into healthcare settings is essential for a holistic approach to children's well-being. Pediatric care providers are often the first point of contact for families concerned about their child's mental health. Collaboration between pediatricians and behavioral health specialists is crucial for early identification and intervention. Coordination with hospitals and emergency services is also important. When children experience mental health crises, hospitals need to have access to behavioral health professionals who can provide immediate support and connect families with ongoing care. Specialty care referrals are often necessary for children with complex mental health needs. Integrated systems ensure that referrals are streamlined and that families can easily access specialized services. Integrated care benefits everyone. It improves outcomes for children, reduces healthcare costs, and creates a more seamless and supportive experience for families. In Section 7, a success story. Integrated care in action. Let's meet Alex, a 10-year-old boy diagnosed with ADHD and anxiety. He was struggling in school, having frequent outbursts, and withdrawing from friends and family. Through an integrated care model, Alex's pediatrician worked closely with a therapist and a psychiatrist. He received therapy, medication management, and support within the school setting. The collaborative efforts of this team led to significant improvements. Alex learned coping skills, his anxiety decreased, and he was able to focus better in school. His relationships with his family and friends also improved dramatically. Alex's story illustrates the power of integrated care. By working together, professionals from different disciplines were able to address Alex's needs comprehensively and support his overall well-being. Section 8. Building a stronger system. Challenges and solutions. While the community behavioral health system plays a vital role, it faces ongoing challenges. These challenges require innovative solutions and a commitment to continuous improvement. Service fragmentation is a common problem. Families often have to navigate multiple agencies and providers, which can be overwhelming and create barriers to care. Communication barriers between different systems can also hinder effective care coordination. Sharing information seamlessly and securely is essential for ensuring that everyone involved in a child's care is on the same page. Funding limitations continue to plague the behavioral health system. Inadequate funding leads to staff shortages, long wait lists, and limited access to services, particularly in underserved communities. Despite these challenges, there are successful models of integrated care across the country. These models demonstrate that with collaboration, innovation, and adequate funding, we can build a stronger and more effective behavioral health system for all children. Section 9, a call to action. Advocating for integrated behavioral health care. The community behavioral health system plays a critical role in supporting the well-being of children and families facing mental health challenges. We've explored the system's structure, the dedicated professionals who work within it, and its vital connections to other systems. We've seen how integrated care leads to better outcomes for children like Alex. But our work is not done. We must continue to advocate for increased funding, improved access to services, and policies that support integrated care. Educate yourself about the resources available in your community. Talk to your elected officials about the importance of mental health services. Support organizations working to improve the lives of children and families affected by mental health challenges. Together, we can create a future where every child has the opportunity to reach their full potential.